I'm a pulmonologist. I see patients that often, unfortunately, when they come into my ICU, half of them, it depends on the week, but anywhere from 30% to half of them will never leave the ICU. Many of them are getting some of the most expensive therapies that exist to see if we can save their life. 30% of healthcare dollars in any given year are spent in the last weeks of life in American ICUs across the country. So I operate in a world of high expense, intense medical therapies where you hope as a clinician what I do in the best interest of my patient in front of me will be covered, that it's not going to cause undue financial hardship. You don't know in every single case if that's going to be the case, but I'm focused always on what the patient is best for the patient. Where it's frustrating for, not obviously for the patient and their family, and then also for me as the provider, is if we hear maybe outside of a critical setting, oh, your insurance is not going to cover that. Let's start with step therapy. Let's start with something that might be covered, and then if it doesn't work, the next thing, the next thing, the next thing. Your viewers, your audience, your listeners, no question they've experienced prior authorizations to some degree or have a loved one that's gone through step therapy. It's frustrating, especially when you know those first three therapies are not going to work, and you want to kick it to sort of the maximum therapy up front. And so there's things that are, there's things that are changing in real time to address that. But it's going to take time. How do we automate prior authorization so that if somebody has a certain set of diseases and data on their clinical status, that we automatically can say, you know what, therapies 1, 2, and 3 are not going to work. We know that with artificial intelligence tools, for example. Let's automatically qualify them for step 4. It's going to take time, but that's happening in real time. So there's hope on the horizon. I will say on the assassination of the United Health CEO, 2 wrongs do not make a right. And in no way should I think we have a false equivalence where the moral injustices that happen in our healthcare system are somehow righted by the assassination of what was a father of a healthcare industry and a healthcare company that, yes, I think needs to be reformed. But murder is not the answer, of course.